Good afternoon, everyone. Welcome to our COVID-19 update for Eau Claire County. We appreciate you joining us and continuing to get good information on what's happening with COVID-19 in this area. Today is Monday, June 22nd. So I hope everybody had a good weekend, had a little break if you were able to do that. And for those of you that are fathers, I hope you had a good Father's Day. Keeping our loved ones safe, it was another reminder over the weekend. Often on weekends, people get together, spend time with one another and with those they love, and certainly on Father's Day weekend, I'm sure that happened for many of you. I hope you took time to make it safe for each other. One of the things we can continue to do is keep physical distance, stay home if we're sick, wear a cloth face covering, and doing those because we respect and love other people. We're trying to prevent others from getting sick from us if we have low-level symptoms or minimal symptoms that we're not even noticing at the time. It's not about politics, it's not about control, it's really about protecting each other and doing that in a way that's fairly simple and easy and is a loving way to care for people in your family and in your community. All of us can build that expectation. We can do that as friends, we can do that as family members, we can do that as coworkers, we can do it as business owners. If we set those expectations and we make it just part of normal operations, we'll do a lot to protect our community. So, happy Father's Day, belated to those that celebrated that this weekend. I'll give you a state status update like we usually do, and then a local update along with a couple of things that happened over the weekend and today, and then be available to answer questions. State numbers, we are now at 466,634 negative tests for COVID-19. Actually, an astounding number of people tested in this short amount of time, something that we should pay attention to. Critically important part of the work we're doing, and important that we are testing people for this disease. Of those numbers in Wisconsin, 25,068 people have now been tested positive for COVID-19. So again, 25,000 people with this disease in Wisconsin in the last few months. 13% of those people ever were hospitalized with the disease, 3,231 people, and we are now at 745 Wisconsin residents that have died of COVID-19. The case numbers continue to be high, and in some counties, very high for COVID-19. And the positivity rate continues to fluctuate, but again, over the last few days at a state level was high again. A few state updates to share before I give you local data. The Department of Public Instruction this morning released their guidance for reopening of schools, K through 12 schools, called Education Forward. That document was just released today. We are still spending time going through it, but there's a lot in there about how to create safer learning environments for our young people moving forward. Again, this disease is one that is a risk for many people, children and adults, especially those that have compromising situations. But also important that school create an environment where people can be physically healthy, but also have those interactions that are so critical for learning and for mental health. DPI indicates that this is supposed to be a fluid document. It will likely change over time as the disease situation fluctuates. And it's a guidance document. So using this document is intended to, be available for local school districts to really think through what is their best option moving forward. Their lead is that the important factor is that educators, students, and families' health is of most importance, and that local conditions may make a difference in what's happening in that school at any given point in time. We've been involved with our local K through 12 school districts since the start of this pandemic, and we continue to be very engaged in the conversations with schools as we move forward. We do have a school group in our incident command structure, and that group has been meeting, the superintendents in that group, public and private schools, has been meeting regularly. We will certainly be digesting this guidance with them and supporting their decisions as we move forward into the fall. Lots of decisions to be made because, again, it's a difficult situation to sort through best practice given the rapidly changing environment with this disease. In Eau Claire, we now have 7,027 negative tests for COVID-19, an increase of 201 negative tests. We have 163 positive cases of COVID-19, an increase of 12 positive cases since Friday. 128 of those are considered recovered. We do now have to report one individual in Eau Claire County that has died of COVID-19. We are sorry for the friends and family of this individual. They've lost a loved one to a disease that is new in our community, and it's critically important for us to pay attention not only to extending condolences to those people, and our thoughts and condolences definitely go to this family, but also what we do to make sure that we continue to take this disease seriously and do those things we can to protect people. We aren't releasing specific individual information on this person for privacy reasons, but we can tell you that this was someone in a higher risk group with being over 65 and with some compromising health conditions. It is also, though, someone that we don't know how they got COVID-19. So, again, not with a known contact and not with known travel. The risk is real. The disease, as we can see from this death, is serious. In Eau Claire County, 1 in 7 people are in the over 65 age group. We all know and work with and love people in this age group. Again, those people are more at risk. We have a responsibility to work together to protect those individuals, and it's important to pause and pay attention to this seriousness. We've been talking about basic precautions for a long time. I think sometimes people get tired of hearing about COVID-19. They don't think it's a big deal. But a reminder that the reason we are doing these things, the reason we are having small gatherings, the reason we are recommending cloth face coverings, and the reason that we want people to do basic prevention of disease is that there's a risk, and it is real. We know that people can spread this virus before they know they're sick. So even if you're healthy, we continue to ask you to keep 6 feet apart from others and respect the distance of others. Ask others to respect that distance when you're interacting with them. Wash your hands frequently and wear a cloth face covering if you might not be able to keep that 6 feet distance. Again, for the privacy of this individual, we're not releasing more information, but we do know of the more than 700 deaths in our state. We know people from the age of 20 through the ages of 90 have died of this disease. None of us is immune. Men and women, all races, all ethnicities. And while over half of the deaths have been in long-term care facilities, that means close to half have not. So this is important for us to remember that people in our community, there isn't a population group or a living situation where you can be guaranteed that you can be safe from this disease. Again, critically important to pay attention to that. Locally, we continue to watch our local data. On Tuesday morning, we pull that local data and review it. We'll make decisions as we look at that data and look at best practice changes and guidance that's coming from the state and federal government about appropriate changes or updates or both directions in our local order. Our local order goes until Wednesday at midnight. And again, every 2 weeks when we review that data, we importantly look at the plan plan, the Respond Together Eau Claire plan, that helps guide our next steps. As you may have seen, communities like La Crosse, where they don't have a local order, have had a huge increase in cases, and they are now recommending closing back down of facility environments. So it is real. If we get cases expanding at rates that are not in a way that we can easily stay on top of them, we will have to look at that as well. We may hold steady, we may move forward or backwards to increase safety, or again, we may move forward and continue to monitor the situation. The risk of illness from the virus in the end changes by what we do and what decisions we make, and I think that's an important remembering of all of us. We make decisions with our businesses and with the environments where we work, but we also make decisions individually. So it continues to be a serious disease. It continues to be a disease that will spread to people rapidly in this community if we're not careful. And those things like larger gatherings and decreased social distance will carry a risk. Please remember to do things that make sure that you are decreasing risk for yourself and for others in the community. We continue to remind you to go to our website, covid19eauclaire.org. That does have the data that we share with you when we join you for these media updates, but that's updated every day. So if you want to stay on top of what's happening with the community data, please go there. On Wednesday morning, we'll update that site with the new measures related to our Respond Together Eau Claire plan. And that website has all kinds of other resources for people as they have questions and concerns. If you can't get your questions answered at the website, please contact our call center number. That's 715-831-7425. And that phone number is really for those people in the community that would like to continue to learn about how they can stay safe as an individual or as a community member or a business related to COVID-19. So I'm available now to answer questions. Yes. So the question is about why do we not release specific information, more specific information that I shared with you about the individual that has died in our community. Certainly, it's really critically important with any disease that we carefully follow our privacy practices so that people are able to know that personal information is not shared. And the health department doesn't do that, and any healthcare provider is in that same situation where HIPAA-related data that can identify us if you work hard enough, is not shared. So we will not be doing that, but we do share that this is someone that is over 65 and did have some underlying health conditions that were in existence. But again, we also don't know how this person got disease. So think about how many people you know that are over 65 and how many people you know that have underlying health conditions, and our risk of exposing them and their potential to, like this individual, die from COVID-19 is real, and we should pay attention to that. Yeah, the individual died, as I understand it, yesterday. The question was, when did this individual die and whether they were hospitalized or not. And again, we're not giving specific information on any individual about those kinds of data elements, but as far as I know, the report to us happened yesterday. Yes?
With the data that's released about the deceased, who decides what gets released, and does the family have a say in that?
So the question that was asked was, with the information about the individual that died, who decides about what is released, and does the individual's family have any ability to influence that? Again, we provide very general information as part of our protection of people's privacy. The family was aware that the death was going to be announced, that is part of our practice. The state website has deaths on notice, and we provide that information as well, and that only very general information would be provided. Certainly the individual's family is, they make decisions about what they communicate, and we sometimes see that in social media or other platforms, but we certainly will not be confirming or participating in providing any more information. Yes? Sure. So the question is, what's my take currently on the new guidelines released by DPI and in-person school sessions starting in the fall? It's certainly a number of months off before school actually starts, and one of our responsibilities in this community is to keep the disease progression as slow as possible. I think as long as disease progresses slowly in this community and we're able to contain outbreaks and contain rapid progression of disease, that a safer start to school in the fall is possible. There are many, many pieces of that decision that each school district will have to make locally. And there's certainly challenges with trying to work through the best way to do those things. With children, there are all kinds of factors, and that's part of why we're working so closely with our school districts on what is happening in schools. Right now, with data released by the state, and they have some new data measures that will be coming out shortly, Eau Claire County is considered in moderate risk of disease, and certainly we are not in a low-risk standpoint right now, and our measures locally are also showing that. So at the current point in time, I think we would be concerned by in-person classes, but certainly as we progress over the course of the next number of months, finding ways to do this more safely, I think is possible, and finding ways to protect children by keeping disease progression as slow as possible in this community will make an enormous difference. If we see an enormous spike of cases and if we see spread happening rapidly, it will be difficult to have those kinds of larger gatherings happening. Yeah.
To what degree is it possible to do it safely, given physical constraints? Mm-hmm. And especially younger kids, I would think, kindergarten, first grade, second grade, like how realistic is it that they can really maintain social distancing and not be exchanging germs?
Yeah.
And to what degree is that a big concern? And maybe it's possible to take special precautions to work around that, but it seems hard.
Yeah. So the question is, how realistic is it with young children particularly to have kids in close proximity and not expect that there's some disease transmission? That is certainly part of what we'll be working through with school districts over the course of the next couple of weeks is where is the risk highest, and particularly for those families, those staff, and those teachers who are in risk categories who may have an incredible risk of coming in contact with other individuals that may be spreading disease, especially with low-level symptoms. There is risk, and I think we all know that with this disease. Nobody is immune, and for those people that may be particularly higher risk, it becomes concerning. The guidance in the DPI document we have not had a chance to digest because we also just saw it this morning, but it includes some practices to work on keeping group sizes smaller, keeping the number of people in contact with one another in smaller, not large group, not large auditorium, not large classroom settings. So there are some strategies being worked through so that a bit more physical distancing can happen and smaller group sizes can happen. So if there is a positive, it's more easily contained because there aren't so many contacts to one individual case. But it certainly is not eliminating risk no matter what we do come fall. Yeah.
Around the nation, there's some cities that are Is there talks of that happening in Wisconsin? No.
So the question is related to discussions in Wisconsin about the mandating of masks. In some places across the U.S., that has become a mandate, and there is a lot of discussion about that. I have not heard of discussions in Wisconsin about a mandate for masks, but there is really clear science available to us that the decreased risk of two people that are in contact with each other, if they both wear a cloth face covering, and it's an appropriately fitting cloth face covering that is a protective fabric, that the decreased risk of transmission of COVID-19 is incredibly stronger than if there's no mask worn. So again, the strong recommendation coming from here and across the state is that cloth face coverings be worn whenever possible. And my ask of the community is to start making it normal, to start making that part of what we do in Eau Claire, so that we raise that bar, and business owners and community partners and community leaders just make it something that we do, so that it doesn't become something that's odd, but something that's odd if you're not doing it. I think the more we can do that for each other, and again, it's not a political gesture. It's not a thing to make a problem out of. It's really something to say, I care about you. I care about this community. I want disease progression to be slow. I care about those people that are at risk, and I'm going to do something to help that. I encountered someone last week that was interacting with an individual that had a farmer's market stand, and the individual that was selling produce was an older person, and that individual had a cloth face covering on. The individual purchasing from them did not, and they were a younger person. And I did stop and say, to protect others, it would be great if we all wore cloth face coverings. And that can be seen as a challenge, and I recognize that, but I think if we kindly and gently to others say, wow, let's help one another. Let's wear our cloth face covering because we care about people in Eau Claire. I think there's an opportunity there. So again, there are some circumstances where wearing a cloth face covering is not recommended with certain health conditions, with very young children, but most of us can wear a cloth face covering. It might not be entirely comfortable, but the more we do it, the easier it'll be. Again, thank you everybody for joining us today. We appreciate people paying attention to COVID-19, and we will be back sharing information with you. And please check the website to get daily updates. Thanks.